Welcome to SATO Career 2.0 online nursing channel. This is AIIMS Nursing Officer Exam Rishikesh 2019 mock question series part 3. This video contains 40 questions for nursing officer exam aspirants. Before going to today's video, please subscribe to SATO Career 2.0 online nursing channel. Let's see the first question of the day. An infant was just admitted to the nursery after an emergency C-section. The nurse's initial assessment is that the infant's skin has a slightly yellow tint. She looks in the maternal history for option A, maternal RH factor, option B, the presence of recreational drug use, option C, thyroid use, option D, ABO incompatibility. Which is the right answer? The right answer is option A, maternal RH factor. The rationale is pathologic jaundice can caused by RH incompatibility in a mother not treated with RHOGAM prenatally. Question number 2. What nursing observation indicates a major complication in a child receiving a blood transfusion? Option A, difficulty breathing. B, brisk capillary refill. C, temperature of 98.3 degree Fahrenheit. And D, sleeping soundly. The right answer for this question. Any guess? Let us see the right answer here. Difficulty breathing. The rationale here, extension of upper extremities to noxious stimuli is decerebrate posturing and signals further neurological deterioration. Question number 3. A 9-year-old with hemophilia complains of increased bruising when playing with siblings. Which lab value would provide an explanation for the finding? Option A, white blood cell count 8,000 microliter, platelet count 1,20,000 microliter, RBC 4.2 million, and HB level is 13 gram per deciliter. Let us see the lab value which will provide the explanation for this case. The right answer is option B, platelet count. This indicates a low platelet count of 1,20,000 microliter is a low platelet count. As a result of that, the client is complaining bruising when playing with siblings. Question number 4. The nurse is caring for an infant who has just returned to the unit from surgery. Which observation would indicate the infant is experiencing pain? Option A rating of 5 on the FACES pain rating scale. Option B, crying and pointing to the area producing pain. Option C, increasing heart rate and sleeping soundly. D, crying steadily and kicking. So which observation would indicate the infant is experiencing pain? So here infant. So the right answer is crying steadily and kicking is the right answer. Question number 5. A post-operative patient refuses to use the incentive spirometer and states that it hurts too much when she deep breaths and coughs. What is the best intervention for the nurse to implement? Option A, explain the importance of the activity. Option B, respect the patient's wishes. Option C, Inform the patient that she will definitely catch pneumonia. Option D. Notify the physician. So the right answer for question number 5. Any guess? The right answer, let us see here. Option A. Explain the importance of activity. One of the nurse's role is to give teaching about any procedure to the patient so that the patient accept that procedure and start performing it. So teach about importance of spirometer. Even though it hurts, it gives good effect in the breathing pattern of a patient. Question number 6. You are a 38-year-old nurse caring for a 22-year-old patient with depression. You are considering a sexual relationship with the patient. You know that preventing harm should be a major consideration in your nursing role. Which ethical issues applies in this situation? Option A. Autonomy. B. Paternalism. C. Distributive justice. And D is beneficence. So according to the question, you know that preventing harm. So based on this clue, we choose the right answer as option D, beneficence. Question number 7. For the last 8 months, Sidhu has displayed the following symptoms: delusions, hallucinations, frequent incoherent speech, grossly disorganized, and flat affect. Based on this information, Sidhu displays the symptoms of option A, obsessive compulsive disorder, B, schizophrenia, C, detoxification, D, anxiety. So the right answer for question number 7, according to the symptoms of delusion, hallucination, and incoherent speech, grossly disorganized flat affect, the problem for Sidhu should be schizophrenia. If the symptom persists for more than 6 months, that is called schizophrenia according to DSM-4 classification of mental disorder. Question number 8. Which of the following condition could be 100% preventable? Option A, schizophrenia. B, obsessive compulsive disorder. C, chronic depression. D, fetal alcohol syndrome. 100% preventable problem in this four. The right answer is fetal alcohol syndrome can be prevented. Question number 9. Which of the following measures would be appropriate to use if you wanted to assess the dementia? Option A, mini mental status examination. Option B, World Health Organization analgesic tool. Option C, caregiver status scale. And D is state right anxiety scale. So the tool used to assess the client with dementia is mini mental status examination. Question number 10. Which of the following is a physical symptoms associated with anorexia nervosa? Option A, tachycardia. B, constipation. C, menstrual cramps. D, weight that is 20% above the ideal weight. So in patient with anorexia nervosa, the constipation is one of the important physical symptoms. Question number 11. A patient has been administered with wrong oral medication. Which action should the nurse take first? Option A. Complete a medication error report. B. Notify the prescribing physician. C. Assess the patient. D. Contact the pharmacist. Let's see the right answer. Assess the patient. Why? Any patient who has given wrong medication by the nurse, the role of the nurse at first is to assess for any side effect of that drug. Question number 12. Because of the lack of insulin in diabetics, The body cannot use carbohydrates for energy and instead uses proteins and fats. Which sign of diabetes does this metabolism cause? Option A, polydipsia, B, overhydration, C, weight loss, and D is paresthesia. Let us see the correct answer is weight loss. When more amount of the proteins and fats are going to be used by the body in a metabolism, that leads to loss of weight. Question number 13. A patient complains of numbness and tingling of the fingers, muscle cramps, and tetany. Which lab value would provide an explanation for the findings? Option A, serum calcium 6 mg per deciliter. Option B, serum potassium 3.5 mg per deciliter. Option C, serum sodium 145 milliequivalent per liter. Option D, serum magnesium, which is 2.7 milligram per deciliter. So here patient complains of numbness, tingling of the fingers, muscle cramps and tetany. So you can see that the laboratory value of serum calcium, which is 6 milligram per deciliter, denotes abnormality in the normal value of serum calcium, which causes these problems. Question number 14. What is the first line treatment for hypercholesteremia? A. Smoking cessation and bile acid binding resins. Option B. Niacin and a low fat diet. Option C. Weight loss and exercise regimen. Option D. A 1800 calorie diet and insulin. For a client with hypercholesteremia, the first line treatment should be weight loss and exercise regimen. Now, question number 15. The home care plan for a patient with congestive heart failure includes rest, oxygen therapy, and diuretics. What is the expected outcome of the care plan? Option A, increase afterload. Option B, increase preload. Option C, increase myocardial contractility. Option D is decrease workload of the heart. So the right answer for this, the decreased workload of the heart is very, very important for the patient who is having congestive cardiac failure. Question number 16. A patient being a patient is taking prescribed medication for congestive heart failure. The lab reports of a serum potassium level of 2.4 milligram per deciliter. Which of the prescribed drug is the most likely cause of the potassium level? The options are option A, furosemide, Lasix, option B, nitroglycerin, option C, metoprolol, option D, spironolactone. Let's see the right answer for this question. Furosemide Lasix is a loop diuretic that inhibits the reabsorption of sodium and chloride and results in diuretics. Potassium is lost through excretion in the distal nephron when the patient receives the drug. The lab result is interrupted as hypokalemia, which is an adverse effect of which is an adverse effect associated with this. Now we move on to question number 17. A patient is pregnant and has been identified as RH negative. When should she receive RHO-GAM, that is RHO-D immunoglobulin? Option A, 14th weeks of gestation. Option B, 36 weeks of gestation. Option C is prior to delivery and D is 28 weeks of gestation. At which period during pregnancy the mother should receive RHOD immunoglobulin? if a woman is RH negative. Then the right answer is at 28 weeks of gestation, RH negative women are assessed for maternal sensitization. If this test is negative, patient will receive RHOD immunoglobulin. Question number 18. A postpartum nurse gives a pain medication to the wrong patient. What should the nurse do? Option A. Nothing. The patient is not allergic and has not experienced any side effects. Option B. Notify the pharmacist. Option C. Complete an incident report and notify the physician. Option D. Notify the physician. So here the right answer is complete an incident report and notify the physician when when the nurse gives the medication to a wrong patient by the nurse. Question number 19. A nurse on the labor and delivery unit has several patient needs. Indicate all activities that can be delegated to their nursing assistant. Option A. Giving a patient on enema. Option B. Assisting with an epidural injection. Option C. Taking the blood pressure of a hypertensive patient. Option D. None of the above. So, which action can be given to a nursing assistant? The right answer is giving a patient on enema can be done by a nursing assistant. Question number 20. A patient admitted for hyperemesis will need a referral to which of the following? Option A. Radiology department for an ultrasound. Option B. Maternal fetal medicine. Option C. Nutritionist. And D is pharmacist. Hyperemesis patient should refer to a nutritionist to get dietary advice. Question number 21. A nurse who is working in the genetics clinic understands that she must be able to option A. Obtain an accurate family history. Option B. Provide a supportive environment. Option C. Understand and communicate the basics of genetic disease. Option D. All of the above. The right answer, according to this question, the nurse must know about all the things in the genetic clinic when she is working in the genetic clinics. All of the above is the right answer. Question number 22. A nurse on the labor and delivery unit overhears another nurse talking about her patient at the nurse's station. The patient came in with a lengthy detailed birth plan, and her nurse says she is sure that the patient will end up with cesarean section because of it. This attitude will demonstrate option A advocacy, option B continuity of care, C delegation, D ethics. The patient came in a lengthy detailed birth plan and her nurse says she is sure the patient will end up with cesarean section because of it. So, what is this attitude demonstrate? The right answer is advocacy. The nurse performs the role of advocate here. Question number 23. Which of the following is not associated with postpartum risk for infection? Option A. Anemia. B. Surgical procedures. D. Multiple pelvic examination. And D is preterm labor. Which of the following is not associated with postpartum risk for infection? The right answer is preterm labor is not associated with postpartum risk for infection. 24. A newly pregnant patient comes to the clinic because her boyfriend has tested positive for chlamydia. The nurse knows. Option A. The infection cannot be transmitted through intercourse. Option B. The infection cannot be treated with antibiotics. Option C, this patient needs to be tested for the infection. Option D, this patient just needs to use condom from now on. So the nurse knows the right answer here. The patient needs to be tested for the infection because her boyfriend is tested positive for chlamydia already. So sexual transmitted disease, chlamydia. Question number 25. A nurse is counseling a newly pregnant patient about handling her cat's litter box. The nurse does so in an effort to prevent maternal infection with option A, trichomoniasis, option B, toxoplasmosis, C, chlamydia, D, bacterial vaginosis. When a nurse seeing the patient handling the cat's litter box, then the nurse must make sure that patient is not getting infected with toxoplasmosis because it is a protozoal infection. It can be easily transmitted when they handle the contaminated meat or animals litter box. And this mother, if not wash the hand properly, then there is sure chance of getting infection. Question number 26. Pelvic inflammatory disease can option A can be cured, B can cause infertility, C can cause ectopic pregnancy, D all of the above. The right answer is all of the above. Pelvic inflammatory diseases can be cured, can cause infertility, and also can cause ectopic pregnancy. 27. The following symptoms may signify the past or current presence of sexual abuse in patient. Option A, postpartum blues. Option B, low self-esteem, insomnia, extreme anger. Option C, waking every few hours in the last weeks of pregnancy. Option D, shortness of breath during pregnancy. So which of these symptoms signifies the past or current presence of sexual abuse in a patient? The right answer is low self-esteem, insomnia, extreme anger. These all indicates the sign of any abuse, particularly sexual abuse in patient. 28. Second trimester teaching includes all except option A, safe use of seat belts. Option B, pelvic rock exercises. Option C, signs of potential problem. Option D, restriction of tub bathing. The right answer. So, except restriction of tub bathing, all the things must be taught for the patient. Sorry, who is in the second trimester. Tub bathing is not a problem. So, mother can be allowed to have bath in the tubs at second trimester of pregnancy. Question number 29. Lack of immunity to rubella identified in the prenatal period requires option A, monitoring of antibody titers during the second trimester. Option B, administration of the vaccine once the lab result is received. Option C, administration of vaccine during the postpartum period. Option D, testing of the newborn's antibody level within 24 hours after birth. So, rubella immunity and prenatal period exposure. So, this gives idea the rubella is a live vaccine and the immunization should be done in the postpartum period to prevent any infection to the baby. Question number 30. The nurse counsels a postpartum patient on the frequency and timing of breast self exam. When should the nurse be conducted? When should the exams be conducted in this patient? Option A, weekly and mid-cycle. Option B, monthly mid-cycle. C, monthly during the menstrual cycle. Option D, every day during the menstrual cycle. The right answer, breast self-examination should be conducted by the patient, by anybody at monthly at the time of menstrual cycle. That gives the chance to identify any abnormal changes in our breast. Question number 31. A patient who is 20 weeks pregnant tells the nurse that her prenatal vitamin makes her feel sick. Which is the best suggestive? Option A. Take the vitamin with breakfast. B. Stop taking the vitamin for few days and then resume. Option C. Take the vitamin at bedtime. Option D. Take the vitamin with milk between meals. So here the right answer is, the best suggestion will be take the vitamin at the bedtime so that it will not cause any other problems. Question number 32. A woman is experiencing back labor and complains of intense pain in her lower back. Which of the following will be the most effective measure? Option A, hemorrhage. B, breathing technique, that is slow pace breathing techniques. Option C, counter pressure against the sacrum. Option D, guided imagery. The best effective measure in this case will be giving counter pressure against the sacrum so that delivery will be very easy. Question number 33. A drug commonly used to manage postpartum hemorrhages. Option A, betamethasone. Option B, factor A. Option C, methergine. D, magnesium sulfate. Postpartum hemorrhage drug is methergine. Question number 34. The newborn whose mother has received a large amount of magnesium sulfate will show which of the following signs? Option A, hypertonia. B, hypotonia. C, tachypnea. D, polycythemia. So here newborn, the mother which will receive, who has received the magnesium sulfate will show the sign of hypotonicity of uterus, hypotonia. Question number 35. Which of the following medications is used to treat some ectopic pregnancies? Option A, pitocin, that is oxytocin. Option B, hemabate, that is prostaglandin. Option C, methergine. And D is methotrexate. The drug used to treat ectopic pregnancy will be methotrexate. All other three drugs used to treat postpartum hemorrhage. 36. What is the recommended route of administration for nifedipine, that is procardia, for preterm labor? Option A, subcutaneous. B, intravenous. C, sublingual. D, rectal. The right answer is, through sublingual only we can administer nifedipine. Question number 37. Erythromycin ophthalmic ointment 0.5 percentage is given immediately after an infant is born to provide prophylaxis against. Option A, Neisseria gonorrhea. Option B, Chlamydia trachomatis. Option C, syphilis. Option D, both Neisseria gonorrhea and Chlamydia trachomatis. So this drug is given to prevent any infection from both Neisseria gonorrhea and Chlamydia trachomatis. Question number 38. The nurse is drawing up a vitamin K injection for a newborn. What should the dose be? Option A, zero point 0.5 to 1 milligram. Option B, 10 to 50 micrograms. C, 12 milliliter. And D is 1 to 12 milligrams. The dose of vitamin K injection for newborn will be zero point 0.5 to 1 milligram. Question number 39. Nursing care in the first 30 minutes after a cesarean section includes. Option A, ambulation. B, oral hydration and nutrition. C, fundal and lochia assessment. D is vital sign every hour. So the main assessment done by nurse after the first 30 minutes after cesarean section will be fundal and lochia assessment. Question number 40. A biophysical profile consists of all of the following measures except option A, fetal breathing, B, femur length, C, non-stress test, and D is amniotic fluid index, which is the biophysical profile test. Except the right answer is except femur length, all other three are biophysical profile assessment. So this is the end of today's question. Don't forget to like this video. Please subscribe to Sato Career 2.0 Nursing online channel to get more information and nursing related questions. Thank you. Bye bye.